Good morning, everyone. I'm Joycelyn Su, the President of the Medical Society and a medical student at the NUS Yong Lu Lin School of Medicine. Thank you very much, teachers, for joining us this morning. Before we start, I'd like to introduce my colleagues at the Medical Society, my Vice Presidents, Yap Chiro and Sherry Xia. Also with us today are Chen Yunru and Wong Shihui, co-chairman of our Mental Health Initiative, mentored by first-year medical student, Keng Xing Yi, from NTU Lee Kong Chuan School of Medicine. They would like to share a few words with us this morning. So Yunru, Shihui, and Xing Yi, please.
Thank you, Joycelyn. A very good morning to our speakers and teachers. I am Chen Yunru, post-A-level graduate from Raffles Institution. Mental health is a topic close to our hearts, especially with the recent happenings in the past month. My friend Shihui and I met up and we had a discussion about mental health issues, which really helped spark this mental health initiative. We sat down and drew up plans for Zoom webinars, amongst many other events, making up this mental health initiative. It was a challenging process, as it was our first time embarking on such an endeavor, with youth pioneering such a big initiative in Singapore. Our Minister of Education, Mr. Chan Chun Sing, said in Parliament recently, our approach should not only be to strengthen the overall system of support, but to engender a much more caring and nurturing environment in our society. And this was what kept us going and pushing on through our ups and downs. These words echoed in our hearts and gave us both the encouragement to push on until today. What about you, Shihui?
Yes, most definitely, Rinru. We started this mental health initiative on 20 July, and we would want to thank all 576 JC1 volunteers, as they are the only reason why we are here today at the successful inaugural first event, Mental Health in Our Schools, a primer for teachers. We would like to thank the teachers present here today, in particular, those who sent us private text messages of advice, encouragement, and support. In addition, we would like to express our gratitude to NJC teacher, Ms. Tan Li Hui, CJC teachers, Ms. Angeline Sim and Ms. Megas, RI teacher, Ms. Wang Yun, and VJC teachers, Ms. Andrea Yu and Mr. Hua Kia Lian. We would also like to thank the RI principal, Mr. Frederick Yeo, and VJC principal, Ms. Ik Su Bin, for their encouraging words. Lastly, we would like to express our utmost gratitude towards our two distinguished speakers, Professor John Wong and Dr. Lee Boon, for taking time out of their busy schedules to speak with our participants today. Over to you, Xing Yi.
Thank you, Shihui. Hello, everyone. I am Keng Xing Yi, a first-year medical student at the Lee Kong Chuan School of Medicine. I will briefly introduce our medical society, which was started in 2020 by a group of medical students from NUS Yong Lu Lin School of Medicine, NTU Lee Kong Chuan School of Medicine, SUTD Duke NUS Medical School, and Singaporeans studying medicine overseas. We sincerely appreciate your attendance today, as mental health is a pertinent issue that requires action amongst our community. Joycelyn, over to you.
Yes, thank you, Yunru, Shihui, and Xing Yi. Moving on, today we are joined by speakers at the Mental Health in Schools, a primer for teachers webinar. They are Professor John Wong, Senior Consultant from the Department of Psychological Medicine, National University Hospital, and Dr. Lee Boon Wee, Senior Lecturer and Health Psychologist from the National Institute of Education, Nanyang Technological University. Our first speaker, Professor Wong, will be speaking on adolescent mental health, well-being, and challenges, followed by Dr. Lee, sharing with us on how to control stress before it controls you. Without further ado, let us welcome our first speaker. Professor Wong, please.
Yeah, good morning. Thank you, Jocelyn and your colleague, for kindly inviting me to share this morning session with many of our teachers. Can I just share screen? Yeah.
Yes.
Okay, thank you. Okay, so very quickly, just to, as what was introduced by the chairperson, I'm John. I'm a senior consultant psychiatrist at the National University Hospital. I work also with Reach West, which serves the western half of the Singapore school zone. Currently, I am the director of My Science Center at NUS and NUHS, and one of the key areas of research and clinical work is really working with students and youth in our school system, in our community, as well as looking and researching with our team of colleagues into resilience, mental resilience, emotional resilience across the age continuum, although I focus more on child, adolescent, and young adult. So just allow me to quickly do a quick poll if you allow me to use the poll everywhere. There's a bit of integration technicality, so I just got to switch screen. Okay, so if you could go to pollev.com / John Wong 281. I just wanted to know where our participants are coming from. I understand there are many teachers, there are also students, there are also school mental health professionals. Could you all see whether you could poll and see if the screen can come live? Let me see whether it's coming live. Does not seem to be coming live. Okay, just let me see. I'm so sorry. Oh, okay. Sorry. The share screen. Okay, now I can see. Okay. Okay, great. Can you all see this? Okay. So majority of teachers are from JC. Okay, I guess this is where your contact is. And some are from secondary school and student. That's great. Okay, I just want to quickly move on to the next one. Yeah, so there are top 10 social issues that teens faces today. How will you rank them in the order of relevance and importance for your school students? Okay. Okay, let me unshare first to go to the live screen. Guess my apology again. Does it work? Okay. This is very, very important for this talk. Okay, anybody poll?
Wong, sorry, we can't see your screen.
Oh, you can't see your screen. Oh, okay.
Yes.
Okay. Okay. Wow. Are you able to see the?
Yes,
voting?
able to.
Oh, great, great. Okay. Wow. Okay. So that's quite typical. Okay, good. So I think we have a good sense. All right. These are the three major issues: depression, academic, and social media. Good. I will take care of that. Okay, let's go to the next one just to get a sensing. Let's see. No response. Poor. Unstable. Stigmatization. Wow. Anxiety, volatility, loss, weaker academic. Okay, so it seems to be much of a really anxiety and directionless. Yeah. Okay, that's very, very insightful. Okay. How teachers can be supported nurturing our students' mental well-being? Training, guidance, some strategies, time, listening, good. Simple guidance, take steps, okay. Debunk misconception, okay. Yeah, I think this stigmatization is probably one important area. Okay, training, good, thank you. I will just quickly get on. I know that time is running out because I do have quite a bit of cover, but I understand that it's such a wide area of coverage. So, okay, So now, so the top 10 social issues that teens struggle with today, I think we have heard that depression, social media, as well as academic stress. These are key issues. So I would like to share with you what have been commonly cited, that the prevalence of digital communication today really have changed how our teenagers, our youth, interact with our peers, and their peers, of course, and their romantic interests. Teachers will probably come across this in JC and high school. And while many teens do develop interpersonal communication skills, but majority of them, especially those who are still in the area of lower secondary school and maybe some secondary, they still are yet to develop the key interpersonal skills. And that's where I think we come across many students having some emotional issues relating to their peers. And I think the other thing to take note of is the social media and texting habit is really influencing how they consume the media, and how they communicate, and how they learn, how they sleep, how they date. I just met a parent yesterday, and his child is really in JC now, taking A-level. The dad, who's my peer, was very concerned that the child studied with 3 digital screen devices in front of him. One was his notes, one was his handphone, checking on chat, and the other one was really a music platform. So obviously to the parent, this is unthinkable, untenable. But the child, this is perfectly normal. And of course, I think the screen time is average on the rise. Some countries have reported as high as 9 hours. Although I would normally share with the parents whom I work with that it's quite fun to have screen time. It's definitely very fun to have games. If we could carve out some time of between 1 to 2 hours a day that is manageable, why not, right? So I think it's sometimes the parents tend to have an idea that is either all or none, and then the likely outcome is that the child would bargain, would try to age, and then as a result, they breach a boundary. Once they breach the first boundary, they'll continue to breach the boundary, and it's endless. All right, so this is a very, very sobering picture I received 2 weeks ago on the social media, as we also use social media. My colleague actually sent me this picture of this young girl. I think it was reported in the newspaper very, very briefly. And of course, even adults, we use social media. They were alerted, they were alarmed. They say, pray that everything is okay. They really were very worried for this child. Then later news heard that she was guided to safety. And of course, we are very grateful and thankful. But the question is that what is happening to our children today? So I think you have voted depression, academic problems, and social media are the top 3 concerns that our teachers will have. So I just quickly go through depression. I think generally, we are currently completing the phase 2 of our Singapore National Youth Epidemiology and Resilience Study. Many of the schools have participated, and some of you probably would have helped us and supported this NUS and MOE program to study the epidemiology of mental health issues of school-age children. Next year, we will be able to submit a technical report to the ministries, and then we will be happy to share the relevant findings from the study, this major 3-year study that is coming to an end in data collection by end of this year. So easily between 10 to 20% of teenagers would have experienced their first episode of depression before childhood. And depression rates among adolescents, especially female gender, is on the rise. And I think what is really worrying is because of the time spent on electronic device, they are prevented from in-person activities with their peers, especially physical sports and athletic sports, which essentially is very protective. And you find that any of the teens who are very active in physical and social sports, they will not only benefit from the physical activity of involvement, but they also benefit from the social interaction and the team spirit and team support and peer support they get. So participating in physical and athletic sports in school is a very, very useful activity to actively promote and support and encourage. But of course, what is happening today is really the FOMO. We are all fearful of missing out. In Singapore, the adult generation, our generation, we call it Kiasu syndrome. But when translated and contextualized into the teenage population, then obviously it is translated into why are they missing out on the social media, on the Instagram and so on and so forth. And bullying is really very real. It can be ranging from 15 to 25% in some schools, some population. Drug use is not so much of a major problem in Singapore. It does appear as a pocket of problem in some of our local community. Alcohol use, surprisingly, we thought it's not a major problem among teenagers, but over the last 2 years, especially during COVID, I've come across more and more of my adolescent teenage patients actually are self-medicating with alcohol. Although they're underage, but they have a way of getting it, either from their home, their family, or through their friends. Obesity is a major issue, not because our people are getting more obese, but people are becoming more aware and sensitive about their body image, not so much from a health perspective, but it's really a body image issue. And as a result, eating habit regulation becomes both a healthy practice and habit, but it also becomes a way that the individual leverage their emotional state, and when it's done inappropriately, then it becomes a major physical health and mental health issue. So in NUH, we run a program for pre-adolescent onset eating disorder. Our colleague SGH runs a national eating disorder program that covers all age group after 14 years old. But NUH, together with our pediatrician colleague, we run a pre-adolescent onset. Our youngest patient was about primary 4. All right. It's quite scary. It does happen, and the numbers are slowly on the rise, and more boys are involved today. Academic problem, as rightly highlighted by our colleague in this forum, dropping out of school is becoming a common reason of referral to mental health services. They feel that there's so much pressure getting into good colleges, and even good college students whom I saw from time to time, they themselves have their set of problems, because the biggest common issue they are struggling with is they don't really know what they want to do. And peer pressure is especially important to take note of. In the social media, it really brings to a new perspective. The sexting is coming out very, very clearly. In the referral from school counselors, we are seeing more of this. It has not exploded yet, but we already started seeing this. There are lifelong consequences. The issue is how can we help our students, our youth, to learn how to say no in an appropriate way and be guided by their family values, religious values, and moral values. Then social media obviously is a great way that we connect, and many of us use social media in a very positive way. But unfortunately, for social media in a youth group, it does create a platform for cyberbullying, for slut shaming, and of course it has a lot of negative effect on friendship, and of course it also can open new ways how teenagers date. Many of my patients who are in Sec 2, Sec 3, Sec 4, they do have friendship with opposite gender, BGL, but interestingly in the past they used to meet out of their friends across the street, because the boys' school is just across the girls' school. But such things doesn't happen nowadays. They actually have friends who are from overseas. They are friends from another part of the country, because they meet on a gaming network and platform. And of course, I think the key issue is that most parents would intuitively just limit the screen time or remove the device. But obviously, we are fully aware that it doesn't work most of the time. On-screen violence is very real. What studies have shown is that on-screen violence shows that actually many of the users, after prolonged exposure to violent video games, it's not that they become aggressive. They can, but not always so. But what is very clear is that with frequent exposure, there is definitely a lack of empathy that can be or should be developed during this phase of their youth years. So empathy is something that one would have to slowly embrace the values and develop the inner skills. But when a person is frequently exposed to online video games, you find that they report much lower level of empathy. Then, of course, this last is really how to talk to teens. Many parents always ask. We have 2 booklets published by Rich West, but we share with all the Rich team. If you want, please email to Jocelyn, and then we'll give you the link to upload the e-copy. We have 2 copies. One is for the how would parents teenage children. Another is really how to help build resilience in school-age children. So those 2 publications were by Rich West, as well as from the year study done by My Science Center at NUS. All right. So I think the key issue is that even teachers and parents, we are all finding awkward sometimes to bring up difficult subjects, especially when we know that the teen can be uncomfortable. And especially we know that teenagers would definitely avoid and shun away from a lengthy lecture or too many direct questioning. So this is something that parents sometimes may not be fully aware. As teacher, we are aware, but sometimes we also are hard pressed for time. So the question is how to really engage them. So what is important to recognize that many teenagers, sometimes they do not seem to be listening, but actually they are receiving, just that they may not be attentively listening, and it may not be internalized right away, but it's through really engaging them and give them a space, a time to reflect or to think about and come back and revisit the issue with them. I think just now the word cloud highlighted this word about listening. Listening to what the teen has to say actually is something that as parents, as teachers, we need to have the time, we need to have our own emotional capacity, and we need to be ready to listen. Very, very interesting. I just met a parent and a child. This is a 4th grade student, very, very bright, IQ of 140, just joined our local school in grade 4. Before that was an international school. And mom was a GP student in her days, very bright parents as well. And the conversation was very interesting. Mom was trying to relay a point of what happened 2 weeks ago. And the 10-year-old child said, "Mom, you are not listening. I didn't say that time." So it's quite interesting that a lot of time we assume, even as teachers, but actually the child or the student actually is very aware whether we are listening or not. Then of course, last thing is to be judgmental. And of course, many of our parents, many of teachers, even we ourselves are at risk of being judgmental from time to time. So this is really the 3 points. One is to really recognizing it's difficult to bring up subjects that makes them feel uncomfortable, and they may not respond to a lengthy conversation, but it's just open up a small conversation point and allow them to reflect, to process, and revisit sometime later. And when we revisit it, it's important to give the teen our ears to listen and avoid being judgmental. Easier said than done, but it's something that has always worked most of the time. All right. But of course, it's important as teachers, as parents, we always say, does it mean that we are condoning the child's behavior? Obviously, no. So it's every right of parents and teachers to have the prerogative to say that we understand what you are doing, but it doesn't mean that we agree with you. But importantly, we want to communicate to them the consequence of breaking the rules. So the key issue is not to judge them that this is right or wrong, but we need to communicate what are the consequences of their behavior so that they can learn from that rather than learn from us. So it's not so much on what we preach, what we say, but it's really let them reflect on the consequences of their action. All right. So very briefly, I think time is really running out. I do have quite a lot to share, but I don't think we have time given that it's really a weekend morning of all your Saturday and you have family to attend to. So I will highlight some of the key issues. Then when there is opportunity for subsequent session, I think we can deal with some of those in details. So I think I'll just quickly run through some of the key understanding of adolescent development. Obviously, we understand that the anxiety, depression, adjustment, youth suicide, student and borderline traits present with eating problems in terms of their habit, or when they develop severe eating disorder condition. We have conditions like internet gaming addiction among our children, among our students. There's a new phenomena that was reported 10 years ago. We are already starting to see in our local students the last 5 years. In Japan, they call it hikikomori. In Hong Kong and Singapore, we call it hidden youth. Essentially, it's a very interesting but alarming phenomena that will slowly grow in our society. Then, of course, in our school system, we do have high ability, high functioning children with autistic trait. How do we handle them? So I will not be able to feature all this, but maybe with the medical society later on, you can just carve out different segment of coverage, and then we can see how to address. But today, I would like to just basically take this opportunity to introduce to you all that there are instruments that is available in open source. Although they are clinical instruments, but it's good to look through it as a teachers, that you know that there are such instruments. And if you feel comfortable using it, or you want to learn how to use it, we are more than happy to have a session to share how to use it, so that it can better equip you to understand your student better. The two instruments that will be very useful is public health questionnaire, PHQ-9, developed by WHO. This is an adolescent version. Our colleague from NUS and NUS My Science Center and our IMH colleague, we are validating it in a year study. So next year, you will have our Singapore norm as well. The adolescent identity disorder assessment, many of us will be wondering how come our children in primary 5, primary 6, and even secondary school starts cutting themselves. Why are they struggling with their identity? So we started looking around how best we can profile an adolescent who are in the growing up years to profile their identity development in terms of a validated psychometric structure. So I met my colleague from Germany, who is a German psychologist, but worked in Switzerland, University of Basel. They developed one for the German and the European community. And 3 years back, when we discussed, we contextualized one version for Singapore, and we have validated with a school locally, but we are doing the national validation so that we have the norm. So this is something also will be released next year. The Singapore Youth Resilience Stress Scale is something that we also validated with a local school twice. And we are doing a nationwide validation from 10 years old to 18 years old. So that will also be available once the Singapore Youth Resilience study is completed early next year. And then the last one is Ask Suicide Questionnaire. This is a simple questionnaire that was developed by the United States National Institute of Mental Health for emergency workers, for frontline workers. I will just quickly show you some of these tools later on. So very quickly, the adolescent we all are familiar with is really a phase that stretch over a wide period of almost 10 years, arising from pre-puberty years to puberty years to post-puberty years. Broadly, it's about 12 to 24. What is unique is that really, besides our understanding of biological and physiological change, as a result, the body development, physical development, sexual maturation happens and completes quite early, between 14 and 15 years old. But interestingly, psychological development is a much longer process that stretch across the continuum until the young adult age. And sociological perspective, I think this is what trap our adolescent and even ourselves when we're growing up in adolescent years. That is while physically they reach puberty physically and adult stature in terms of physical and medical status, but unfortunately sometimes the law and the rights given to them may not catch up. So many of us are aware that in Singapore and many countries, the legal rights is empowered to an individual when they reach 21 years old. In some countries, they're brought down to 18. And this is still a struggle among different countries as to whether 18 is the right age or 21 is the right age. And I think what is really fundamental to this is how would the society accept their participation and what they should be taken into accountability for some of their action. So the psychological change obviously is obvious to many teachers here, is that our students, our teenagers starts to develop abstract thinking, which is probably an important area of cognitive growth, and they also develop introspective ability. And this is something that our education system and curriculum development has really taken into how to pace the development in these two cognitive strengths. But what we may not have done very strongly, both at the family level and as a society level, not necessarily the school, is really how to help our teenagers establish moral values and norms according to their families' value system, the society value system. So this is something that is lagging behind in these two aspects of development. The crisis that can happen during an adolescent year can be frequently reported to be as high as 15 to 20%. And as a result, many of them actually develop mental health issues. And the important thing is that from a neuroscience perspective, when they do neuroimaging of the brain, they find that the brain actually develop in staggered fashion, and the maturation of different locus and control center in the brain actually is paced differently. So the subcortical structure mature earlier, and this play a dominant role because they are able to have a greater visual spatial ability. They are able to have a lot more functional control of the physical state of the person. But the emotional development and the reward system, which is we call the limbic system, this is really what drives the emotional reaction. They mature later. So the common localized colloquial analogy is that as a teenage grow, you just look at the papaya trees that is in your neighborhood. The papaya will grow once the flower is fertilized, and as the fruit mature, it grows very fast, but it stays green. All right, and obviously we know that unless you cook the green papaya as a dish, otherwise it's just not ready to be consumed as a fruit or as a dessert. And you really need time for it to turn yellow and to ripen. So the analogy is quite similar. During adolescent year, it's almost like a grow of papaya. The papaya takes a full shape and the size and the weight of a ripened papaya, but it just needs the time to slowly process and evolve and mature. And this is where the limbic system and reward system take additional time. So the hypothesis is that because of this, there is a much more pronounced risk-taking behavior that could be related to some of the observed social behavior like alcohol drinking, drug use, speed driving, and sexual contact. This is more prevalent in the Western culture, but local culture, we do see some of this in some family where the parents probably leave their children to have a lot more space and independence. And of course, what we see clinically is really a higher incidence of emotional disorder and affective disorder, and of course more frequent interpersonal conflict. So what is commonly observed in a more in a common place in school is really how peer bullies takes place and how they get affected by peers. So just very quickly share a little bit of some of the early findings of some of the recent findings. So one of the instrument we used was use self-report instrument from Ackenbeck. Is 112 items, but essentially the students and the youth essentially will be invited to answer questions that covers 20 social competency items, but they also assess aggression, oppositionality, the anxiety, attention and hyperactivity issues, mood, personality traits, psychotic or atypical behavior, risk-taking and impulsive behavior, social interaction, physical problems or complaints or substance use. So very quickly, just a few, these are very raw, but they are data from the study. And they shows that actually when we look at the YSL score, that means the overall area of distress, you find that actually at 11 years old, P5, all the way to JC, they actually 18 years old, the absolute score actually rises But what is important is that peak around 16 years old. So from a school perspective, definitely we want to be start looking at them from P5, P6. But what is important is that we'll expect more challenging issues that the teens will have to face when they reach Sec 3 and Sec 4. Interestingly, by the time they pass post-secondary education system, they seem to mellow down a bit and drop a bit. So this is a very interesting phenomenon where I think secondary school teachers will have a hard time, and maybe JC1 teachers will have some leftover from here to handle. All right, and by the time they reach JC2, probably the rates stabilize. What about anxiety and depression? You can see that same thing by 15 and 16, it starts to rise and peak. All right, and then JC1, JC2, or ITE. This includes ITE students and poly students as well. All right, but these are really Sec 4 students. And then you look at aggression, again starts to rise and start to peak around here. Okay, so I'll just quickly show you this. This short teaser. Are you able to see?
Yes. Prof. Wong, sorry, is that supposed to be audio?
Okay, so very quickly, this teaser basically is a McDonald's advertisement, but it does depicts the challenges and the romantic the intensity of romance of youth. But that makes it so beautiful, right? The young man is so charming, the young lady is so beautiful. He was willing to dive into the open ocean, open sea, just to retrieve the stalk of rose for her. It's so wonderful. But when it comes to real personal issues, the time having a meal together, is about the self and the me, and the impulsivity, and this is really what happens in day-to-day life. Nothing good, nothing bad, but it's a reality. So looking at our teenagers, our youth in the population, we have 20% of people in the teenage years. So very quickly, I think what is unique in our population pyramid is that we are fully aware, government has been telling us, and our young parents and more children, this is really the effect. This is in 2019, we have a narrow base population. The current youth is narrow compared to Asian population. They are about 15% of the population who are 15 to 24, but we only have about 12%. So we do have a serious replacement problem compared to other countries and nations. But what is important is that when you look at the youth, whether they are getting fewer and more precious individual, but they still have to go through their own personal phase of psychosocial development. And I always like the Erik Erikson model, although people have critiqued that it is a Western model. But over the years, after working in psychiatry and mental health, I find that it's still very relevant even in our local context. So you find that in teenage years, the identity and role confusion is really what they have to process and grow in this area. And when they are trapped, or when they are entangled, that's where a lot of emotional upheaval and challenges can present itself. Then of course, intimacy and isolation. And of course, in the younger age group, Sec 1, Sec 2, P5, P6, you find that this is a time that they have the window of opportunity to grow, to take on more exploratory kind of responsibility and learning. So it's a wonderful time actually when you get to teach P5, P6, as well as Sec 1 to Sec 4, and of course our JC teachers here as well, to really understand how we can play a part in their character development and in their personal growth, besides imparting them the knowledge and the life skills. So someone asked, what is the purpose of youth? I thought this is quite a nice caption. Is to really enable young people to develop holistically, working with them to facilitate their personal, social, and educational development. So what does it lead to? To allow them to develop a voice, to influence, and to have a place in the society to reach their full potential. So this is the part that I thought very nicely captured what it means by youth. But when we ask our youth, sadly, 6 out of 10 says, I really do not know. What is my purpose? Right. And if you could capture this and go and share with your students, I think many of them suddenly will find that, hey, there's so much ahead of them. It's so wonderful. Right. All right. So very quickly, I want to just cover a few issues because I guess with the time, I won't be able to show you all the slides. So just excuse me, I will have to skip some slides. But not to worry, if there are areas of interest and needs, you work with the medical society or whoever, just let us know. We will try to work out some other sessions to cover some topics in greater detail. So emerging issues and trends, I think resilience among the youth, I think I came across this magazine quite a few years back, but it's still very relevant today. The cover story for Time, it says that it's the me generation. It seems very incriminating of our youth colleagues and friends, but actually there is nothing right or wrong, good or bad, but it is a fact that we are brought up in an environment that we are a little bit more focused on our needs, on ourselves, and as a result, if we don't develop the value of empathy, it is very difficult to see beyond myself. And this is very much influenced by our society values, how this Mimi has impacted on emotional wellness and impacted on sense of autonomy. So we talk about early socialization with digital world. We talk about easy access to unlimited knowledge and resource. So everything is delivered very quickly. Now, even with food delivery, sorry to say, even our teenagers don't even step into a restaurant. Everything is delivered on the plate to them. And secondly, I think want to highlight that what impact on our society is really the effect of dual income family. I'm a strong advocate that for the first 5 years to first 6 years of early child development, for one of the two parents, we should not be sexist to say must be mother, but one of the two parents to have the financial means to choose to work half-time, part-time, or to not work, but to be a privileged home parent. Because you find that the lack of parenting involvement in grown-up years is really paying its price in our society, in the family. So as a result, there is this frequent lack of self-regulation or dysregulation of behavior and emotional wellness in the youth. But I need to qualify, when both parents work, when they are extended parents, grandparents, caregivers, domestic helper who take on the caregiving role of a parent with the empowered authority, but more importantly, with the emotional capacity to respond to the child's emotional needs in a timely and warm manner, you find that they also grow up well. So what is important is that it's not just being father or mother being at home, but father, mother, or the caregiver, I call them surrogate parents, need to be empowered with the authority to guide, to be a mentor, to share the emotional burden of the child, and to be able to nurture them in a timely, responsive way. And this was really very much evidenced by Israeli study. The nation of Israel many years ago were involved in 7-day war, Lebanon war, and so on and so forth. So they actually, the men all go to the battlefield, and the mother will actually stay in their community to work in the factory to get the economy going, so that they earn enough revenue to buy their weapons, their ammunition, so that the men can go and fight their battle. Rightly or wrongly so, for the reason that they are fighting for. But that's how they run. So what happened to the children? So they have community childcare center. The child will live there, and they call it the kibbutz. And the study from the kibbutz was very interesting. They have house parents. That means some mother may go to work in factory or offices to get the economy going. But some people actually are assigned role to be house parents in the cupboard, in the childcare facilities. And these house parents, they find that house parents who are warm, who are responsive, who are able to care and be consistent in the child minding, the child grew up as well as other children who grew up with their parents. So this is something important, and we do see in some family where they have very, very helpful, loving helper or grandparents who actually take on the job, even though parents may be away working somewhere. But of course, the trade-off is that the parents will not be emotionally linked or close or attached to the child, and vice versa. But at least the child grew up with a secure attachment with one important caregiver. So dual income family is not totally bad, but it's just that we just take it for granted, and with no replacement of a warm, nurturing caregiver, then obviously it can be very, very disadvantageous to a child. Okay, I think it's about 5 more minutes. So just to quickly look at some of the issues we see in the child and the youth, is that in the recent weeks and months, we all were very, very shaken by the youth suicide, the youth aggression. But actually, this is really the tip of the iceberg. Under the water, a lot of emotional issues are happening, and many teachers are fully aware. Many of our students cut themselves since P4, P5, P6. In the past, 10 years ago, I only see children, youth in secondary school cut themselves. But in the last 2 years, as young as P2, P3, they start cutting themselves. So what is happening to our children? Actually, that's not the question I want to ask. The question I want to ask is what's happening to our family. All right. So it's not an issue that teachers, school must handle. It's an issue that our parents, our family must handle. So that is a different discussion altogether. Of course, depression becomes really the top voted concern. I just want to share that as a clinician, I find that our children and all of us can be depressed from time to time. But when we are depressed and we have anxious personality or overthinking thoughts process, it makes our depression worse. And you find that your children, your students, if you come across any of them who are depressed, those who are just purely depressed but not anxious type, they do recover quite quickly and quite well. Those who actually go into protracted depression and doesn't seem to be recovering, you inevitably find that many of them actually have a very anxious personality or anxious avoidant personality or even anxiety disorder as a comorbid. I think school performance is a major issue and it's relative. So I do see students who are GP program or integrated program schools. Obviously, for them, school performance is not about failing. It's about not getting the straight A's. Right? It's a relative issue. All right. So I think it's 5 more minutes. I just want to round off with the next few slides. Just want to bring to our attention that in Ministry of Health, our colleague actually monitor very closely what is the cause of disease burden in our healthcare system. And for a young medical student, you look at this chart, you probably will have an idea what kind of job you can get or is available to you when you graduate, because these are the demand of our healthcare system. So this chart basically is a chart in the earlier years, first published by Ministry of Health, and every 5 years they publish, and it's available on the website. They study the disease burden. A disease burden is basically a public health tool to help a country or a healthcare organization, or in this case MOH, to understand what is going to be the demand for healthcare services. And how do we define that? It's really and it's also used by WHO, World Health Organization. It's defined as disability adjusted life years, DALY. And it's expressed as a sum of years of life lost due to premature mortality. Means they pass on, they die earlier than what you expected life expectancy. And of course, plus a year lost due to disability. So if a person is still alive but not able to do certain things, that year's loss is significant, a loss to the person. So you find that in the children 0 to 15 years old, among the top 10 conditions that create the greatest disease burden, mental health and neuropsychological issues actually occupy 3 of the top 5. Autism spectrum, we are all aware, is really highest disease burden in the young age group. Asthma, interestingly, is second, and because there are too many children who are asthmatic. But ADHD is the third. Now we know why teachers are introduced during the NIE teaching training days. They are introduced to how to identify early cases of ADHD children. Low birth weight, but anxiety depression is the fifth. All right, for this young age group, we'll never imagine someone at 0 to 15 years old will have anxiety depression, but it is there. Even congenital heart disease is so devastating for the parents of the child. It's only 6 because there are fewer cases. All right. Then for the youth, the late teens and the young adult up to 34 years old, anxiety depression is the top. Schizophrenia, that's where it appears around 20 to 30s, is the second. Young age diabetes is the third. Road traffic accident is fourth. Self-inflicted injury is the fifth. And then all our eating problems, regulatory problems with bulimia, anorexia is the eighth. Then of course, adult is really anxiety, depression, again is the fourth. And then schizophrenia, self-inflicted injury is the sixth. So basically what I'm saying is that for teachers and parents, when we bring out our children or work with our children in this age group, inevitably we will come across these 3 conditions. Inevitably we will come across these 3 groups. And this explains why secondary school teacher and JC student will probably come across JC teachers and secondary teachers will come across more students with eating related problems. All right, so I think I will need to stop here. My apology. I have actually 3 sets of slides. One is really how to manage self-harm from a psychological perspective. And I have a second set of slides. Maybe I'll just stop here. Second set of slides is on a study that we did for adolescent, where they attempted suicide with the intent to die. We studied their parenting experience, how they perceive their parents parented them. And we also have a set of data on the tools. Let me just quickly show you the last few slides on the tools. Go straight to the tool so that you can have something to take away. Okay. So I'll just quickly run through the next 2 minutes. Just allow me to exit 2 minutes. 2 to 5. Okay, so I mentioned our PHQ. Okay, so this is the PHQ questionnaire. Is owned by WHO and it's free. You just Google PHQ-9 modified for adolescent, and you just simply note whether it's actually meant to be self-reporting. The students, the youth actually report themselves. So if you think that you are not too sure whether to profile it, this is how we profile, and it does pick up depression in a pretty I would say sensitive way. And that's where you can discuss with your school counselor, or maybe you may not want to use it. You ask your school counselor to administer for you. All right, so that's a PHQ. This is the assessment identity development questionnaire. It was developed by our colleague in Germany and Switzerland, but we have a local version. This is our local version. It's a bit long, about 55 questionnaire, but it does give very good understanding of the importance of how they actually profile their continuity and discontinuity of their life experiences, as well as their congruence, because sometimes there are so many things happen in their life, adverse childhood experience, good experiences, and sometimes it's so conflicting and so paradoxical, they get very confused. And as a result, their identity becomes multifaceted. So this is a tool that will be available. So we look at the continuity and discontinuity and incoherence. All right, so you can see this continuity skill, and so there are 2 axes to measure. And then the other tools that we are using is the Singapore Youth Resilience Skills, and that was validated in 2006 published locally by NUS, by our department. So there are 10 domains that actually helps to profile the child. But what I really want to impress you and show you is that we have worked with one of the school in Singapore. They have a small intake and they profile the children, the student in year 1, year 3, and year 5 to allow the students and the teachers to work together to identify the areas of strength and area of need to develop. So across the 10 domain and map onto the school ECA, CCA, and pastoral care program. We do not want the school to go and create new program because there are more than enough programs in Singapore. What we need is for people to recognize the matching of program and to optimize the learning benefit. So this is a school where the whole cohort of 100 over students, you find that they score, this is a skewed population because they are the high ability student. They skewed towards humor and positive thinking, positive self-image and optimism, perseverance and commitment. But of course, being high ability, they are also less flexible. Doesn't mean that it always worked that way, but for this population, they were less flexible. They had less sense of perceived self-control. All right. So, but it's still above 50 percentile. So it's not that it's totally below the water. It's just relatively, these are the area of strength of this group. All right. So for the school, we actually help the school to profile different class so that the teachers understand that this particular class form teacher would have group of students who are relatively stronger in this area and relatively need development in this area, so that during the pastoral care session, they focus on program that could help develop this. And this teacher had all the cold sweat. They say, my students all were comparing to the year cohort were relatively lacking in this. So they had to factor in more understanding of what is it that they need to help the student develop. And this tool also allow us to map individual students. So based on their self-report, they are able to be mapped onto, we call this a radar chart. So for this student, the sense of relative self-control is low, but the other areas is pretty high. So it's a very strong resilience profile. And of course, this student has a relatively stronger self-control, but in terms of positive coping, humor and even spirituality is a little bit low. And this is really the average student that is developed. And this is really 13-year-old child. And the last question I want to share with you is you go and Google NIMH or NIH National Institute of Health in US or NIMH Institute of Mental Health, ask questionnaire. So these are direct questionnaire. It's developed for emergency frontline worker, for school counselors. You can use it to ask pointed but simple question, not offensive, but to really know whether the risk is high or not. All right. So I think I will end here. I'm sorry that I cannot cover everything I had wished for, but at least I thought this will open up a conversation. And if you have any question, feel free to let the organizer know. I'll be happy to address and follow up on this issue. So thank you very much.
Hi, Prof. Wong. Thank you so much for your speech. So everyone, my name is Sherry and I am the Vice President of the Medical Society. I'll be relating a few questions that you guys have typed in the Q&A to Prof. Wong now. If you have any further questions, please key them in within the next minute. So Prof. Wong, a lot of teachers are interested to know what are the subtle signs of depression that can be picked up early in their students.
Okay, so very quickly, I think if you refer to the PHQ-9 for adolescent, there are 9 questions there. The most sensitive question will be, let me just share the screen again. Okay, so the most sensitive, can you all see this?
Yes, we can.
Okay. Oops. Come on, end up here. Okay, sorry. Wait. Okay. So the most sensitive question is, are you feeling down, depressed? I mean, we call a spade. Let's not fudge around. Are you feeling irritable or hopeless? Irritability is a very, very useful sign to look out for someone who is anxious. They can be irritable before they become anxious. For someone who is depressed, before the full-blown depression comes, usually it's irritable mood, right? So if your spouse is irritable in the morning, better look out whether the person is not just being angry, but whether the person is upset with things in a general way or the mood is low. So the second is really the little interest or pleasure in doing things. So these are the two highest predictive value question. Are you feeling sad? Are you losing interest in doing things that you normally do? The rest about sleep, appetite, feeling tired, little energy, all this are questions that will help to build the case of suspected case of depression. But if you really are short of time and you think that the child is not ready to have a long conversation, ask the first two questions. That will be a good screener. Yep.
Okay, thanks, Prof. Wong. The next question is, how do we help parents or teachers be aware that they are judgmental when engaging in conversations with teens?
Okay, so I always share my MOE colleagues and those colleagues of guidance branch in MOE that our school system is near perfect. I must say that our school system is near perfect. Being a student of our education system, I have the opportunity to study overseas, and I've studied opportunity to work overseas. I have the opportunity to work in the university to teach medical students nowadays. I would say that our education system is near perfect. And what is it that is not perfect is that I think we are just trying to do too many things to the point that we are almost doing parenting. All right. And what is not perfect in our system is our parents are not parenting. So the key issue is really, I cannot say that it's not an MOE or ministry issue, but it's really bigger issue at the national level, at the society level, at the family level. And that's where in a conversation with my colleague in MOE was that we really need to work hand in hand with MSF to support families who are disadvantaged. They do have a lot of other issues outside education, but as a result, their child is spending time in the school and it becomes a school problem. But the source need to be sorted out. So I would say that if you would allow me to suggest is that when parents are difficult, I have children who went through our education system. Sometimes we have to look at the mirror ourselves. So the best thing is that put a big mirror at the school entrance before they see you for parent meet the teacher session. But honestly, I think we have to recognize that some things are not really meant for MOE or for teachers to take on this burden, but really to bring up to the parents that how can we help the child? How can we help your child? It's not so much of what is the school must do in order the child will do well. It should be the other way around, that parents take on the responsibility. But of course, it's most difficult on the ground. It's just that as a doctor in a hospital, relatives are unreasonable many a times. Although we do have very nice, appreciative family members, but there are so many unreasonable family members. But we have to deal with them more on a customer service recovery model. But when it comes to treating our patient, we still treat our patient as best we can. But there are certain things are beyond the scope of doctors. We need to call the priest, we need to call the monk, we need to call the spiritual leader. We ask the family to do that, right? So I think it's something that we won't be able to really cover everything. What I think can be one useful thought for teachers and school counselors to consider is that if you do identify or assess or sense that the family is disadvantaged, or the family, the parents themselves have a challenging issue themselves, then I think we need to mobilize social welfare services like Family Service Center. So the best person to get help on your side is work with a school counselor. And then sometimes if they are a rich case, a school-based mental health case, then get the school-based mental health reach team to help to wire up the social network to support the parents. Don't take on the parents directly on your own. It's just not worth the while.
Okay, thank you, Prof. Wong. The next question by Miss Jenny Cheng is, how do we help students who have been self-harming?
Oh, wow. Okay, that was in a set of slides I didn't manage to show. Two things. Can I just ask and share that I had good experiences and bad experiences from patients' encounter with their teachers. First is that I think as a teacher, we are so-called obliged by the school system and the ministry system to look out for safety of our child. So that is something very important that we do our part. It's just that when a patient admitted to the hospital, we will need to look out for their safety. Can you imagine from time to time, which you don't read in the newspaper, there'll be patients who actually jump off from a high-rise building in a hospital ground. It is very devastating for the nurses. It is very devastating for the CEO, for the doctors who care for the patient. All right. So it's something that very real, that, and worse still, after that, there'll be BOI, COI, the committee of inquiry, and there'll be so many investigation reports to write. How come we never do this, we never do that? So I think first thing we must set our minds that our duty to care lies at certain level of boundaries. But our wish to care has no boundary as long as we can make sure that we have self-care ourselves, that we don't get emotionally overwhelmed. So our duty of care, we must be very clear and work with the school leadership and the ministry, what is our duty of care. And do not be unfazed or to get too worked up by all these rules and regulation, but work on the first principle that we do want to care and love our children in the school. So the question here is that there are two parts to the response. One is immediate, one is follow-up. The immediate follow-up is that if we do spot early sign of self-harm, like for example, we notice that a student wearing sweater, long sleeve shirt where technically they shouldn't be covering up their wrist, or wearing a handband covering their wrist, then we have some index of suspicion. So I would say that it's important to not to ask the child in the public because they may feel embarrassed, but to really find a time, if you already know the child very well, very personally, find a time, say, can I talk to you in a room after the break? Just go and invite the child to the room and sit down and chat. Or if you really have no time, bring your school counselor along and together bring the child, accompany the child to the room and have a closed door chat. And then if you're busy, you can just extricate yourself and let the school counselor handle for you. But someone to really show the care and concern, rather than saying that, why are you covering your wrist? Why are you wearing sweater? All the children and all the adults don't like why. Because they got to think hard how to answer you. And if they try to avoid being detected, they'll give you a lot of excuses, and then that will make you more angry because you feel that they are not telling the truth. The second thing is that after bringing them to a safe place and find out exactly what are the issues, then you got to decide whether it's an acute problem or it's something that's ongoing that you have more time to work on. If it's an acute, a crisis, then probably need to do some crisis management. But if it's something that has been ongoing, she's been cutting for the last 6 months, and this is just another cut of her self-soothing, then you have more time. You say, okay, let's see what any current urgent issue we need to work out. If there is, we work it out. If there isn't, then maybe let's arrange to meet up at the next session to find out more about it so that you can buy time. But of course, anything that signal acute threat to life, safety, then of course you really need to mobilize your school system to help. The last thing is to say is, I won't mention school. I have a patient who came to the hospital, took an overdose. The trigger was very simple. She was cutting herself almost for about 9 months. And then the teachers was aware. And then that day she went to school after a cut. She was afraid the teacher would notice. So she wear a sweater. And that particular teacher said, you cut again. In a very, very conversational way, and the student literally freak out. And to make things worse for the student is that the teacher say, you are not allowed to come to school if you cut. And I would want you to go home today. So in our school rules, yes, I think it's safe. No, we want to hand the child to the safety of the family, so on and so forth. But the student felt totally rejected and ostracized. So I think the key issue is really how to provide a warm environment. Of course, we do not condone the behavior, all right? And we want them to know the consequences. But the consequences is not so much of a rejection. The consequences is that they know that with all the cuts, they will get scarring. Their problems will continue to run deeper and deeper. Those are the real consequences to them. The consequences shouldn't be a school suspension, right? Because the child really want to go to school and learn. Otherwise, after cutting, the child will not be in school actually. So I think all of us have good and bad experience with our school-age children. But I think the key element is really what do we have the mental and emotional capacity to handle it? Because some of us at that point of time, we may be overwhelmed. We don't have the mental capacity and emotional capacity. It's okay. We just need to tell ourselves, okay, maybe I should ask another colleague to work with this child and hand over. Then we extricate ourselves. Then we will not end up with a confrontation with the child. All right. Okay. It may not answer all your questions, but I hope it helps.
Thanks, Prof. Wong. Thank you all participants for your responses and your active participation. I'm afraid that we've run out of time and we need to move on to our next speaker, Dr. Lee. Prof. Wong, you can take your leave now. Thank you very much.
Just allow me to answer the question and then I'll answer the question and then I'll take my leave.
Oh, okay.
I can type and answer the question, right?
Okay. We have quite a few questions. How about we email you after this?
Okay.
Thank you so much, Prof. Wong.
Okay, bye-bye, everybody.
Bye. Next up, we have Dr. Lee Boon, who is a senior lecturer and health psychologist from the National Institute of Education, Nanyang Technological University. Dr. Lee, please.
Hello. Hello, Jesslyn. Is it? No, sorry, Joycelyn. Okay, so can you make me as a host or co-host?
Yes.
Yeah, thank you. Do you think that they should have a break?
Up to you, Dr. Lee. Would you like to give them a break for about 2 to 5 minutes?
Maybe about 2 minutes.
2 minutes, okay.
Okay.
We'll be back in 2 minutes.
Yeah, thank you.
Dr. Lee, I think you will be able to share your slides now.
Yeah.
Yeah.
Can you see me a slide?
Yes.
Yeah, thank you. I have to end at 12, right?
About 12:15 is fine too.
Okay, maybe we can start.
Yeah, we can start. Thanks, Dr. Lee.
Okay. Just give me a minute. Okay, good morning. So sure. Yeah, so this is almost noon, and so I hope that all of you are doing well. I want to thank the Jocelyn and the Medical Society for inviting me to give a talk on teachers' mental health. Well, for most teachers, teaching is a calling, is a passion, is a rewarding and fulfilling career. But teaching can be also very demanding and stressful. I'm not saying that stress is so it's not important, but stress is actually quite common and very normal. But having too much stress can compromise our quality of life and may increase the risk of burnout, severe mental health issues such as depression, anxiety disorders, and also some physical problems. So I hope that in my session, I can help teachers to become more aware of their stress so that they can learn how to cope with the stress so that they can be a better teachers. So what do we mean by stress? Well, stress is actually a reaction to the way that we interact with the environment. The environment here refers to social environments and physical environment. For social environments such as workplace, family, peer groups, and so on. And we're not just simply occupying a space in the environment. So we are living, and so we're living by performing some roles to meet some expectation. For instance, as a teacher, we are expected to equip the students with knowledge and skills, and as a parent, we are expected to take care of our children. At times, this expectation may become a kind of demands. So if we do not have the resources to meet these expectations or demands, or demands, then we will have this reaction called stress. So stress happens whenever that we do not have the necessary resources to cope with the demands from the environment. So this lack of resources can be actual lack of resources. For instance, if we are given a very short time to write a report, that means that we do not have enough time resources. Then we have this stress reaction. But even if we are given enough time to complete a report, for instance, we may still feel stressed. The reason is that we may think that we do not have the necessary knowledge or information to write a piece of report. Due to our low self-confidence or maybe low self-esteem. And so in other words, whether we really have the lack of resources or it is our perception, we will have this stress reaction. And how do you know whether we are under stressed? Bodily, we may feel tired, we have fatigue, and emotionally, we may feel anxious, tense, agitated, irritable. And in terms of thinking, our thinking may become a bit muddy, disorganized, and we may keep on thinking about the stresses again and again and again and again. In terms of behavior, we may tend to overreact, we may tend to overeat. Then in terms of the interpersonal relationship, we will have conflicts, we have social withdrawal, and so on. So one of the useful way to find out whether we really under stress is to compare our current states of mind and the previous condition. For instance, if we used to be a very a socially active person, and somehow we become a bit socially withdrawal, and then we don't want to mix around with other people, or maybe we used to have very good sleep, and then so now we have nightmare, or students' problem coming to a dream, or maybe so we're unable to concentrate and so on. So maybe we are having certain kind of stress. Now, having high level of stress, of course, will lead to poor level of functioning. But stress is not necessarily bad, because we need a little bit stress to push us to do something. For instance, during examination, so we need to be a bit stressed in order to be alert, to be vigilant, in order to be careful not to make any mistake when answering the question. So that is why that we need to have a moderate level of stress in order for us to survive, in order for us to do some task to meet the expectation in the environment. Now, according to one studies in Singapore, so these are the common sources of stress that the teachers are facing. They're being ranked in order. So the most common one is the work overload, followed by work interfering with personal and family life, unfulfilled job responsibility, and self-expectation. So this self-expectation, as I mentioned before, is a kind of self-imposed demands. So which means that so the demands are not coming from without, but coming from within yourself. You're imposing certain demands, something that you're not able to meet, and as a result, you will have this reaction called stress. Other common source of stress include unnecessary task and red tape, insufficient support from colleagues. But less common ones are low evaluation of the teachers from society, so which is the professional image, and the conflicting or insufficient support from superiors, the heads, the principals, and so on. Now, as I said before, is that stress is a common and normal reaction, and we need certain stress to be motivated to manage certain tasks in life. But if we have stress over a long period of time, which is what we call the chronic stress, and we will have this risk of developing burnout, which means that emotional exhaustion, you find that you're very tired, and then even if you used to be a very emotionally stable person, but then now you become so tired, and then you do not want to do anything. Another sign of burnout is the depersonalization. You distancing yourself emotionally from people. So you become apathetic, and so you just do not want to pay so much attention to other people that you used to take care of, and so on. And another symptom of the burnout is the reduced personal accomplishment. You may used to be a very motivated person, you're very ambitious, you want to be the #1 teacher in the world, but then now, and then you become so disappointed with yourself, and so you do not want to do any kind of work anymore. But of course, not all teachers or not all people, after having chronic stress, they will have this burnout, or they will have all kind of psychological problem. And so some people, in spite of having stress or also chronic stress, they're still able to maintain relatively good level of well-being. And so this is what we call resilience. So resilience means the ability to attain positive psychological functioning despite exposure to life adversities. And so why do some teachers they can maintain relatively level of well-being in spite of having stress? And then why do some people they end up having burnout or other severe mental disorders. And one of the factors is the way that they cope with stress. So for those people who so far able to cope with stress effectively, then they are able to reduce the impact of the stress on their quality of life. And so this is what we call the adaptive coping. And for teachers who may not be able to cope with stress effectively, or they even use maladaptive coping methods to manage the stress, then they will end up having burnout. So let's look at so what we actually means by adaptive coping. So as I said before, having stress is common and normal, but we have to keep stress at bay. And so when you want to cope with your stress, so you have to ask yourself, what kind of coping methods that you're using? So there are three types of adaptive coping: emotion-focused strategy, problem-focused strategy, and social support. And the effective way to manage stress is to understand the nature of the stressor, or the characteristic of the stressful situation. So if you think that the stressor can be changed, can be removed, then you will use the problem-focused coping method, which includes learning new skills, acquiring knowledge and behaviors, and taking action, and then to do planning in order to solve the problems. Should you find that the situation or the stressor cannot be changed so easily, then you will have to use the emotion-focused strategy, which aims to learn to adapt to the situation rather than to change the situation. These emotion-focused strategies include relaxation, acceptance, self-distraction, venting, positive reframing, which means we'll see things from a positive perspective, humor, letting go, and spirituality. So if you're not really aware of the nature of the situation, and so if you use the wrong coping strategies, for instance, if you're trying to change a situation that cannot be changed, then you actually can increase your stress. Now, let me give you an example. For instance, many teachers during the appraisal exercise, they can be quite stressed. So, of course, if you're using the problem-focused strategy, is you ask the school and the MOE to remove the appraisal exercise, but which is impossible. And so, in other words, this stressor is something that cannot be changed. So a better coping method is using the emotion-focused strategy to learn to adapt to the situation. I will moving into the adaptive coping in more details later. Another adaptive coping is social support. Because we are all social beings, we can never live in the social vacuum. And the social support is a very, very important support that you need to get in order to cope with stress. There are two types of social support. One is the emotional support, where you you share your grievances, your problems with someone, and emotional and instrumental support is the person gives you concrete, tangible kind of support. For instance, teach you how to do something, and then or even provide you with financial support, or maybe give you free lunch and all these things. So so in life, we need to receive both the intangible, which is the emotional support, as well as the tangible support. Now, as I said before, is that some teachers or some people, instead of using the adaptive coping methods, they use the maladaptive coping. Includes denial. Now, using the same example such as appraisal exercise, especially if we compare denial with the self-distraction. So for instance, when we stressed, for instance, that during the appraisal exercise, we feel very stressed. In order to to de-stress ourselves, we read books, or we watch movies. But at the back of our mind, we still know that there is the existence of the appraisal exercise that we need to pay attention to. But for denier, so you tell yourself that, hey, there is no appraisal exercise. Okay. Another types of maladaptive coping is substance use, such as drinking and smoking. And behavior disengagement is that you totally give up. You do not want to work on the task that you are given, and also you may tend to blame yourself for causing the problem. Even the stressor is actually coming from another person or from the system, and then elsewhere. So so how do we know whether our coping methods are effective? So if, let's say, after we try to cope with the stressor, our stress level still maintains high or even becomes worsened, so that means that you may be using the maladaptive coping. Let's look at what are the common coping methods that our Singapore teachers are using based on a study done in Singapore. Again, these coping methods are being ranked in order, with the most common ones are being ranked on top. The most common ones are attempting to deal with a problematic situation. So this is a problem-focused strategy. Changing perspective, which is the same as reframing. It is an emotion-focused strategy. Setting limits of work, for instance, not letting work affect family or social life. This can be both emotion-focused or problem-focused coping methods. Seeking information and divine support can be problem-focused or emotion-focused. Seeking advice and support from others can be social support. Relaxation is emotion-focused. Suppression of feelings, to some extent, that this may not be so healthy, because, well, of course, that depends on some people. I mean that sometimes share your emotions with other people can be a very good release of your inner kind of feelings, so that you will not, because if you tend to suppress emotion over a long period of time, it will become like a time bomb, and then so just waiting for another trigger to let this thing to become a very serious one. And so suppression of feelings definitely is not a very adaptive kind of coping. Blaming others may not be necessarily adaptive as well. Retreat, for instance, putting off attending to the problem, sleep or eat more than usual. So I'm sure that all of us do have this experience that whenever that we stress, and then we tend to keep on eating and drinking and so on. No, I mean, to some extent that this can be functional, but then on the long run, this may not be necessarily functional or adaptive. So some teachers, I mean, not so common, they are seeking professional help, talking to counselors. So I'm sure that all of you know that the MOE and the guidance branch provides emotional support to teachers as well. Even like in my own clinical work, some of my clients are teachers or former teachers. Of course, that their stress may not be necessarily directly related to school, but the stress they encounter in school can worsen their mental health condition. Other common, less common kind of coping methods are seeking medical help and somatic relief, where they're taking medication, and this is not so common based on the study. Drinking and smoking. So this is, of course, if it's just simply social drinking, to some extent, it is quite functional, adaptive. But then, if you're drinking too much, everything which is going above the moderate level, which is considered as maladaptive. So let me go into the detailed ways of coping. So these are some of the suggested ways of coping for you. Creating a conducive work environment. Now, this is for the policymakers and for the superiors in the work setting. So in the school setting, and this is a problem focused strategy. So conducive work environment includes support from colleagues and supervisors. As I shared with you, the research finding before is that one of the sources of the teacher stress is a lack of support from the colleagues and the supervisor. Another way to make the work environment in school conducive is to manage the workload, which is another source of the problems that teachers are facing. Other than that, including work-family balance, access to ongoing professional development, including today's talk, and conducive organizational policies and culture. But I think that over these past 10 over years, I've seen MOE has put in a lot of effort, and schools have put in a lot of efforts to help teachers to cope with the very demanding kind of jobs and so on. Yeah, but we still, but I think that we have to keep on changing the policy and culture in order to be in line with the changing landscape in the society. For instance, the mental health issues have become much more serious, and so are not just affecting the students, but also affecting everyone in the society, including parents and teachers. So even if we say that we have to even if we say that one of the sources of the student stress so it's coming from the family, but parents are equally under stress as well. So they're not so sure how to take care of the children and so on. And another suggested way of coping for the teachers is to set priorities. Nowadays, we have too many things to do in a very short period of time. And it is very important for us to have very good time management, to learn how to prioritize our work. So the step is to set a list of tasks that you want to do, prioritize them in terms of importance and urgency, and allocate time to complete each of the tasks. It is very important for us to be realistic and to have breaks between tasks. The list of the priorities and the time spent may be different on a daily basis. The important thing is that once you accomplished successfully a list of tasks just for today, you shouldn't move on to another list. So you have to be very disciplined. And prioritization is a very important psychological skill because it helps to increase the sense of controllability and predictability. One of the sources of, one of the reasons why we become stressed when the environment or the situation becomes uncontrollable or unpredictable. For instance, there's a rise in mental health issues during the pandemic. One of the reasons is that the pandemic is quite unpredictable and uncontrollable. And so we do not know what will happen tomorrow or maybe a few days down the road and so on. And the situation can become a bit ambiguous because there could be different conflicting pieces of information. For instance, whether certain vaccine works or also a certain vaccination, so it's harmful and so on. So when the situation becomes very ambiguous, so we tend to feel much more stressed. So the prioritization will help you to manage something which is uncontrollable to become controllable, to make something which is ambiguous, and then to become much more clearer and concrete to you. And now our life is not perfect. There are ups and downs, and there are some aspects of our life are not meaningful. For instance, like so maybe you ask yourself, why am I doing this kind of thing? It is so meaningless. Why am I so asked to do that kind of thing which I'm not really interested in? And so whenever that you find some aspect of your life not meaningful, for instance, if you find that some work in school are not so meaningful to you, and of course that you still have to do it because that you're required to do that, but you have to pay a little bit more attention to other aspects of your life which are meaningful to you. For instance, if you feel happy to be with a family, then you have to allocate time in your list of the priorities to spend time with them. For instance, like during weekends, after office office hours, and so on. Another way to make your life much more meaningful is to engage in something enjoyable to you, to do something that you feel happy. And for instance, flower arrangement, drawing, singing, playing instruments, and so on. But you have to do something that you feel interested in. Otherwise, that thing will become a chore, will become a task, or become a demand to you. If you do not have hobbies and interest, then we have to develop and create hobbies and interest. And we can also change the hobbies according to what we can do right now. And another aspects of the life that you can make yourself and then make your life meaningful is to resort to religion and spirituality if you believe in certain things, because religion and spirituality so there's evidence to show that religion and spirituality is a very important coping method for stress and mental health issues. Now stress reaction, as I mentioned to you earlier, are not just affecting our thinking, but also affecting our physical body, our emotions, and so on. And so we need to take time to learn to relax our emotion and body. Now, we don't really have to do something which is sophisticated. So what I'm introducing to you here is a kind of breathing exercise which you can learn very easily, and you can now you don't have to spend so much time to do it. So so these are the steps that you can use. First of all, concentrate on taking breaths right down to your stomach. Okay, so you breathe in, so together with with the stomach. I mean, this is a kind of diaphragmatic breathing exercise. And keep your breathing smooth and fluid. The third step is to start to count on your inhalations. I mean that you breathe in, and then whenever you breathe in, you count 1. So you silently, so you tell yourself 1, and then when you breathe out, you think the word relax, or so any phrase or word which are meaningful to you, and think too on your next breath, and in and relax on the breath out, and continue this up to around 10, and then go backwards to 1. So you breathe in 1, 2, 3, all the way to 10, and then you repeat. Whenever that you breathe in, you say to yourself 1, and so whenever you breathe out, you say to yourself relaxed. And focus only on the breathing and the word. Let's say if your mind wanders, if you're thinking about the work in your school, and then so just refocus on your breath. And it is nothing mysterious about focusing on the breath and the word, because whenever that we feel stressed, our breathing becomes much more faster. So you regulate your emotion by controlling your breath. So you're teaching your brain in order, and so now that you're feeling much more composed, and calm. And counting the word is just simply helping you to concentrate on what you're supposed to do in this particular moment of time. So this will help you to reduce the tendency of rumination, so which means that your tendency to keep on thinking about the problems again and again and again. So as I mentioned before, that social support is one of the adaptive copings. And because we are all social beings, we can never live in social vacuum. And so just like I said that the focus on some aspect of the life that are meaningful to you instead of ruminating the the aspects of a life which are not so meaningful to you. And so you can engage in a meaningful and pleasurable social activities together with other people, such as going for sports and exercise, or maybe doing something, or maybe like concentrating on a board game, computer game together with and then with some other people. And then to take care of other people, to be compassionate towards other people, just like to take care of yourself. And never reject helps from other people. Some of the teachers that I'm working in, in therapy, so they told me that they do not want to give burden to their family members and then to their friends, their colleagues, and so on. But remember that in this world, we're helping each others. And then, as I say, that we are all social beings, and so it is very important for us to accept and not to reject the support from other people. And taking care of your body is very important because our mind and the body are not separated. Whatever thing going on in the mind will have an impact on the body, and then whatever thing happens to your body, and then it will affect your mind as well. So you can engage. So it is very important for us to engage in physical exercises. There is evidence to show that physical exercises like jogging, simple as jogging, maybe walking, can help to reduce the risk of depression. And so do not just simply doing exercise indoor. If your body allows you to do physical exercises in the outdoor environment, then try to do outdoor activities. The reason is that you can divert your attention away from your home environment. For instance, when we're under stress, we have this tendency of ruminating. And so if we got nothing else to do at home, then we tend to have this, then the thoughts will become very invasive. So when we go out to do exercises or to engage in some social activities, so our attention will be paid onto other people or to the surrounding. Other very important ways to manage stress is to sleep well, because one of the symptoms of stress is insomnia, or maybe have the tendency to sleep too much. So learning to sleep well is a very important coping skill. Then also to rest, to eat well. Okay. So in this presentation, I have given you ideas about stress, the nature of stress. So stress is a reaction whenever that we are unable to cope with the demands and expectation in the environment, such as the school environment, the home environment, or in any kind of social environment. And there are different ways of coping with stress. So some people, even though that they're under tremendous amount of stress, they'll still be able to maintain a relative level of well-being. So it all depends on on how we actually cope with our stress. So there are two types of coping methods. One is adaptive, another one is maladaptive. For adaptive coping, it includes emotion-focused and problem-focused and social support. It is very important for you to know the nature of your stressor and the situation. If the situation cannot be changed, use emotion-focused. The aim is to adapt to the situation. And if the situation can be changed, then adopt a problem-focused strategy. Never use the problem-focused strategy to try to change a situation that cannot be changed so easily. And we often tend to use both together. For instance, we will learn how to relax first before we embarking on the problem-solving approach. And another adaptive coping is social support. Remember that social support is a very, very important coping method. And so we need to get emotional support or instrumental support from our friends or loved ones and colleagues and so on. Then after that, I brought you through some of the coping methods in details. For instance, how to build a conducive work environment for teachers to work in, and then to find meanings in life, to recognize that there are different aspects of our life. So some are meaningful and some are meaningless. And so we to strike a balance by creating meanings in our life. And then I also talk about to lead a healthy lifestyle by engaging in physical exercises, to sleep well, to eat well, and so on. Okay, so with this, I end my presentation. Thank you very much.
Thank you, Dr. Lee.
Mhm.
Good afternoon. My name is
Yep.
Tiro, and I'm the Vice President of the Medical Society. I'll be moderating the Q&A for this session. So currently we have a few questions, but teachers, if you have any further questions, just type it into the Q&A chat box and we'll address them shortly. Okay, so Dr. Lee, for the first question, Dr. Lee, I know of people in the teaching fraternity who feel alienated, socially isolated, and not supported due to frictions and social politics in the office with other colleagues. Currently, I try to help them by engaging and allowing them to vent. What else can I do to help them cope? What advice can I give them to help them improve on their relationships in the workplace?
Well, I think that is so one of the very common problems that I see in my therapy, and work relationship can become a very important source of stress for teachers. And so one way, of course, I mean that to help that teacher to adapt to the situation. Okay, so that's one thing. The second thing is that to couple it with the problem-solving coping method, it is to help the teacher to learn how to deal and then to communicate more effectively with another person whom that she has problem with. And okay, but no matter how is that, whenever that we want to manage the interpersonal relationship problems in a school setting, is that the best effective way is to involve another person whom that so the teacher is having problem with. And so that will be much more effective. But let's say if another person somehow cannot be involved in the whole process of help, or even refuses to and then to stay in the help. In the whole helping process, or even another person may blame your colleague, like, I am not the source of the problem. So you're the one who got problem. Then you should try to manage the problem. It's not me. Then in that case is that we can only help so the teacher to learn to adapt to that kind of situation, and then to learn how to cope with, and then to learn how to and then to communicate much more effectively with another person. And so I often have to tell some of my clients that in life, well, this is not really philosophical, but I think that in life is that we cannot please everyone in this world. And so there's so often that we find that some people don't really like the way that we do things, and then don't like the way that we behave in certain way, don't like our face, don't like and then our mannerism and so on. And so long as we have not really creating a lot of problems, and so I think that we have to accept that is a reality. And so we just have to focus on whatever thing that we need to do. And but let's say if the interpersonal problems will really affect our work together, so I think that we have to really have to involve the superior, such as the principal, I mean the level head, and so on. Yeah. So I hope that I answer your questions. Yeah.
Okay, thank you, Dr. Lee. And then another question. So if the teachers feel like they need professional help and support, what are some resources that they can access, or where can they go to find such support?
I understand that MOE does have the have a branch. Okay, no, yeah. So the MOE does have this guidance branch, and so the professionals in the guidance branch can provide supports to the teachers who are under stressed. There is also a section in the MOE provides counseling services to teachers who are under stressed, but not all teachers like to receive help within the organization for all kind of concerns. For instance, they don't know what, because sometimes they don't trust the system, whether they'll be confidential, privacy, and so on, whether that will affect their appraiser and so on. And so then they'll end up seeking help from external professionals. For instance, like, so I maintain an active private practice, and then some of my clients are actually teachers and former teachers. So that will help them to ensure a sense of privacy and confidentiality. So the source of the professional help, so the teachers can go to the Singapore Psychological Society, so which has a list of the registered psychologists, and or go to the website of the Singapore Association for Counseling, which has a list of the registered counselor. So the teachers can look out from this external body. Apart from this, so this former professional mental health professionals, and where the teachers can also seek help from their own own informal social support, including clergies, including religious personnel, the priests, the monks, and so on. And as I said before, is that religion and spirituality is a very important coping method for stress. And so if now for those teachers who are religious, then perhaps that they can also seek up from these professionals.
Okay, thank you. Okay, so for the next question, right? Sometimes when I'm feeling stressed and faced with things that I'm worried and unhappy about, I catch my thoughts going down into a downward spiral, and it leads to even more negativity and a buildup of anger. I think maybe this is what you are referring to when you mention ruminating. So how do I stop myself and my thoughts from going down this downward spiral?
Well, that is a very good question. Yeah. Now first of all, we need to know that we cannot control our thoughts. And so if we ask if we ask ourselves not to stop thinking, that is quite impossible, because there's always certain things coming in our mind. And so this kind of spiral down thinking, or so rumination, is a kind of maladaptive thought. So these thoughts are associated with the negative emotions. Whenever that we are depressed or anxious or angry or frustrated, then that will affect our thinking. Because when we're depressed, of course, that we think very negatively. So that's impossible to think positively. Then in return, so the negative thinking will lead to much more negative emotion. So whenever that we think very negatively, so we and then we tend to have depression, anxiety, and anger, and so on. Then it will become like a vicious cycle. So negative emotion, and then will result in negative emotion, then which in turn will result in the negative thinking. So we'll be in the vicious cycle. So over the long period of time, the thoughts becomes a bit sticky. We become automatic, become invasive, and so the way to stop this negative thinking, okay, is to, and first of all, is to learn how to regulate the emotion. Because as I say that the emotion can become the cause and the consequence of the negative thinking. So by regulate the emotion, we can, so we become happier. So our thinking will become a bit less negative. Now, then we also have to target the and then to manage the negative thinking, because this because emotion and thinking are so intertwined. So when we try to stop the thinking to become the invasive and automatic and spiral down, one way is to stay in the to be focused in the present. For instance, right now, I am sharing with you the ideas about how to manage ruminations. Okay. Of course, not everyone will pay attention to what I'm talking right now. Maybe you're thinking about, oh, why are you going to have party tonight because Saturday night, or maybe you're going to do something else much more enjoyable, later. Yeah. So you have to tell yourself that, hey, I want to focus back onto what Dr. Lee is talking right now, so you stay on what you're doing in that particular moment can help you to stop the negative thought from going on and on in your mind. So if you don't believe me, is that if you have another thought that's coming in right now, then if you don't pay attention to what I'm talking to you right now, then you find that that external thought become, and then will go, and then will become like a radio, keep on playing on and on and on in your mind. So you have to tell yourself that, hey, so now let's focus on what I'm doing in this particular moment. So that is why that one of the coping methods I shared with you just now is to do something which is enjoyable. So when you're doing something which is enjoyable, so you focus on doing something that you like to do. So you put the thought at bay. So, and then, then you prevent the thought coming into your mind. Okay. Thoughts will be, the thoughts becomes automatic and evasive, and then becomes ruminating, is that when your mind becomes vacuum. So you need to occupy a mind by doing something else, but you need to focus on something that you like to do. So that is why you have to focus on something that you like to do in that particular moment. So that thought will not coming in again and again. And you need practice, because if you don't practice it, then you'll find that there's a competition in your mind. Then there are two things. One is a positive thought, another one is the negative thought. They will be in competition. So you have to force yourself or to learn how to focus on something that you like to do, so that the intensity of the negative thought becomes less. So over time, the rumination would becomes much more controllable. But one important thing that you need to not to do is to suppress your thoughts. Never suppress the thoughts, because if you suppress the thoughts, the thought is just okay. So the negative thoughts. Yeah, because there's no reason for us to suppress our positive thoughts, you see. So if we want to suppress our negative thoughts, don't do that, because the negative thought is not really removed. It is just staying in your mind, waiting for another opportunity to surface. So focusing on the present is to do something that you like to do. It's not suppression. So suppression is, and then you try to suppress it, and then not doing anything. Okay, so that is why that focusing on something that you do in that particular moment, something pleasurable, will help you to kick out and then to reduce the rumination in the long run. Yeah.
Okay, I see. Thank you.
Okay.
Okay, another question. Teachers constantly face technological fatigue from many avenues, such as ECCA, online meetings, online lessons, online parent-teacher meetings. So is there anything that can be done to alleviate this fatigue?
Yeah, as I say that the fatigue is a consequence of the stress. So so perhaps that is the sign of the stressor, and you may want to consider using the prioritization to set the list of the thing that you have to do just for, so just in that particular day, and as I say that the list will help you to control the many things that you are expected to do. And a very useful way is to write it down. So don't use your brain and your mind to remember those things that you need to do, because our mind is very limited, because we have too little time to do too many things. So we have to offload our memories onto an external device. So by writing down, you can see clearly what you're supposed to do within today, or maybe for the next 2 days, and take one step at a time. And so let's say if you have 10 things that you're supposed to do within the week. So as I said before, is that assess the urgency, the importance, and so on. And then you have, say, 5 things to do on Monday, and then 5 things to do on Tuesday. So then on Monday, the 5 things they're supposed to do, the 5 tasks, again, to look at the urgency and the importance, and then to allocate time. For instance, for those things that they find that so need your urgent attention, then you give more time to do. Then you allocate less time for things that which are less important. So take one step at a time. Then before moving on to Tuesday, Wednesday, and so on. Never just simply use your mind and the brain to remember these 10 tasks. Don't do that. So write it down on a piece of paper and chuck it aside. Because once you transfer, so this is something like a kind of extended mind, where we offload something from our mind, then onto a piece of paper. Then psychologically and physically, you are dissociated from the task that's supposed to do. So you only focus on the 5 things to do in that particular day. So that would be much more easier. Okay. Of course, I mean that there are many other things is that you need to have the knowledge and the skills to complete the task. It is not just a prioritization. I mean that if you do not have the knowledge or the skills to do, then even if you come up with so with the best list of prioritization, you still cannot manage your stress.
Okay, thank you. I think just one last question. So sometimes teachers may not know how to manage counseling students because of the anxiety they feel while managing their own heavy workload. So how do you balance this, and what do you advise them to do?
Yeah, I think that's a good question. So at NIU we just launched a certificate in school counseling. So if you're interested, you can join the certificate in school counseling to learn how to work with students, because you need to have certain knowledge and skills. Counseling is not something that you're born with it. Because counseling is a very emotionally loaded kind of thing, and if you're not careful, the student's problem becomes yours, and the student comes into your dream at night, and then whenever that you want to mark assignment, then you keep on having this image in your brain. Well, just like some of the medical doctors, I mean, that they tell me that their patient come into their brain, so into the dream, yeah. So in that sense is that you really need to learn how to work with students who got emotional problems. And simply just sitting down to listen to their problems can be quite harmful to your mental health. If you don't believe me, is that if you just simply listen to your colleagues who got grievances, and so you feel very tired, and then you may not, so you may be in the lost. So my advice is that you need to attend certain level of training, basic counseling skills, to learn how to work with students who got emotional problems. And second thing is that work very closely with school counselors. So the scheme of school counselors was launched in 2008. The reason was to release the teachers from doing counseling work. And of course, we know that because based on my own study and based on my own research, we find that a counselor can never be the first line of help. Students, whenever they got problems, they prefer to seek help from their friends and family, and so on. Even teachers sometimes are not necessarily the first level of help. One of the reasons that why students don't seek help from the counselors, the school counselors and teachers, is a fear of confidentiality and privacy. And so if you really want to help your student, you really need to keep confidential about what your student is sharing with you. But the problem is that once you talk to the student, you know something, some of the secrets, and you can't help but have to share with other teachers, and because you may not have enough resources to cope with the stress of the student, you see, and but once you share with somebody else, even with the school counselor, you're breaching confidentiality, and the student will become very angry. And the worst too is that the student may broadcast, hey, this teacher, big mouth, share with other people about my problems. Then they will lose trust, not only in teachers as a source of help, but also lose trust in school counseling. So that is why that in my own practice, I have parents coming to see me for their children's problem. Why? That because the children don't trust the teachers and the counselors. Yeah. So this is why that we really need to learn how to maintain the sense of ethical issues, but it is very controversial. So this is why that if you really want to provide counseling to your students, I strongly suggest that go through a proper basic counseling skill training, which is provided by the guidance branch and also by NIE. I'm not selling Goyo, but I'm saying that it's important for you to have certain knowledge and skills. Yeah. Okay. That's about all, right?
Okay, thank you, Dr. Lee.
Thank you.
Teachers, thank you so much for the responses. I'm afraid we've run out of time and we can't answer any more questions. But once again, thank you very much, Dr. Lee, for joining us today, and you may take your leave. Okay, we have come to the end of the webinar. Thank you, teachers, for joining us today. Do look out for our line of mental health initiative events on our website at themedicalsociety.net, and encourage those you know to come join us and participate actively. Have a good afternoon, everyone.